Hello, my name is Nkechinyere Oranusi.
And my name is map-Agan, and we are presenting our concept map. So we have a 27-year-old white female who comes in presenting of chief complaint, quote, I feel tired all the time. I am having dizzy spells, and sometimes my heart feels like it is pounding, end quote. History of present illness reveals that she's had a 3-month history of feeling tired all the time and having dizzy spells on occasion. She also complains of heart pounding onset 2 weeks ago. She describes more difficulty completing daily tasks, quote, because I feel exhausted all the time, end quote. She takes 2 or 3 naps throughout the day, but states this does not help. She describes the dizziness as head spinning and lasting just a few seconds. She states they can come at any time of the day. Nothing seems to make it better or worse. She has occasional nausea with these spells, but no vomiting. She denies passing out. She states the pounding of the heart only happens once or twice every few days and is very brief, maybe lasting a second or 2. She denies increased stress, anxiety, or depression. She describes heavy menstrual periods in which she changes maxi pads 5 to 6 times a day, but she states this is not unusual for her. She states it usually lasts 8 days and is regular in timing. Last menses was 1 week ago. She states also that she has been eating a lot of ice lately. Her past medical history is significant for migraines, for which she takes Tylenol extra strength, 650 milligrams every 6 hours. Her other current medications include a multivitamin, 1 tab, daily, which she has taken for 5 years, ibuprofen 400 to 800 milligrams every 6 hours when she has cramping during her menstrual periods. And she states she also takes zinc 30 milligrams every day. She has an allergy to penicillin, for which she states she gets hives, and she is current on her flu shot. Her family history is non-contributory. Her social history, she denies history of alcohol use. She smokes a half a pack of cigarettes a day, and she has no illicit drug use. She works part-time as a waitress, and she has no children. Her review of systems, she denies any recent weight gain. She denies fever, but she does report some fatigue. She also reports dizziness. She states she has no problems with her vision. She has no problems with her hearing. Her neck, she reports no lumps or swollen glands. She denies any cardiac history, and she denies fainting. For respiratory, she denies difficulty breathing. For GI, she does report nausea, but she denies vomiting. She denies any foul smelling, black or tarry stools. She denies diarrhea or GI upset, and she denies abdominal pain. For OBGYN, she denies bleeding between periods. She uses condoms for birth control, and she is sexually active. Neurologic, she denies numbness, tingling, or weakness. Hematologic, she denies past transfusions, and endocrine, she denies cold intolerance.
For the objectives, general appearance, and appears as stated age. She's alert and oriented to person, place, and time, and in no acute distress. Just tired. Her vital signs are temperature 98.6, 18/83, 05. Respirations are 20. Her weight is 185 pounds. Height 5'6". Pain 0 out of 10. Physical examination. Her skin is warm, dry, and intact. Mild pallor noted. No cyanosis. Her head is normocephalic and atraumatic. Her hair is with average texture. Her eyes, the sclera is white and the conjunctiva is pink. Her pupils are equal, round and reactive to light and accommodation. No hemorrhages or exudates noted. The tympanic membrane is intact bilaterally. No structural damages to the ears noted. Her mucous membrane is intact and pink. Ulcerations to the mouth. Her neck is supple. Trachea is in midline. Her thyroid is palpable with no enlargement. It is soft, smooth, symmetrical, and non-tender. She has mild tachycardia, no abnormal heart sounds noted, and she's normal rhythm. Her lungs are clear to auscultation bilaterally. Neurologically, she has clear speech without cognitive impairment. However, the Rumbuck test elicits dizziness. Soft, non-tender, and no mass is palpated. Her diagnostics and labs include CBC. The hemoglobin is 10.2. Hematocrit is 32%. MCHC is 28. And the MCV is 75. Her urine pregnancy test came back negative, and her EKG also came back normal sinus rhythm. We have pregnancy, arrhythmias, and iron deficiency anemia. For pregnancy, she's having the fatigue, and also she's of childbearing age. For hypothyroidism, she's having the fatigue and palpitations. The arrhythmia, she's having the fatigue, the dizziness, and the palpitations, so we have to rule that out. And also iron deficiency, she has fatigue, dizziness, menstrual periods. All in all, our diagnosis for this patient is iron deficiency anemia with ICD code 10 of D50.9. The patient is ferrous sulfate 325 milligrams PO once daily in the morning. We also want to send out for T4 and TSH level. Also, we want to send out for serum ferritin levels. The family health model. We want to encourage the family to be involved in patient care by helping the patient with eating habits, support, and with smoking cessation. Patient education for the ferrous sulfate include take it with meals. It may darken your stools, cause nausea, constipation. However, do not take this medicine 2 hours of other medications. Do not take with dairy products, tea, coffee, whole grain cereal, bread 1 hour before or 2 hours after taking iron supplements. We also want the patient to stop taking the zinc because it can inhibit the absorption of iron. We want the patient to return to the clinic for a 3 weeks follow-up CBC. And that concludes our presentation.